Welcome to this POLITICO Healthcare Summit panel discussion, where we'll be looking at whether European health data is too precious to be shared. I'm Ashley Furlong, a healthcare reporter at POLITICO. It's a really timely discussion as Europe reckons with how it wants to shape the future of health data sharing. The most significant development in the coming months will be the Commission's legislative proposal for the European health data space, which we will be delving into more during the session. The pandemic has also shown how important the sharing of vaccines, the sharing of data is for effective surveillance, the fast development of new vaccines, and good care for patients. But this sharing of data can be almost meaningless when there isn't standardization, when the data doesn't talk to each other. We've also seen cases where data sharing has gone really wrong and privacy and security breaches have occurred. Before we start, just a few housekeeping tips. Please do ask questions via the Swapcard platform. All instructions are on the event website. You can ask questions at the bottom right of the screen if you're using a desktop, or below the live stream if you're on a mobile. And please tweet about the events using the hashtag POLITICOHealthcare. I'd like to introduce you to our panel of excellent speakers. Online with us, we have Markus Leyck Dieken, the Managing Director of gematik. Hi, Markus.
Hi, Ashley.
And we also have Ioana-Maria Gligor, Head of Unit Digital Health and Head of the European Reference Networks at DG SANTE. Hello, Ioana-Maria.
Good morning.
And in the room with us, this is really great to actually have people in the room. We have Estelle Massé, Senior Policy Analyst and Global Data Protection Lead at Access Now. Hi, Estelle. And we have Maurizio Cecconi, President of the European Society of Intensive Care Medicine and Chair of Anaesthesia and Intensive Care Department at Humanitas Research Hospital in Milan. Hello.
Hello, Ashley.
To kick us off, I'm going to start with a question to each of you to sort of set the scene. What was the most important learning for each of you with regards to health data sharing during the pandemic? What do you think the pandemic really revealed about health data sharing? I'll start with the online speakers. Markus, would you like to give that a go?
Thank you, Ashley. I think what we learned is that it is not a question of technology, it's a question of societal agreements. And we in Germany saw with a lot of envy, quite frankly, that countries like the Nordics or Israel or some other smaller countries came to an agreement very, very quickly, while we had a longer debate about this and we lost precious time until then. Although technically, obviously, Germany is able to present good digital convincing tools. We also learned that we are the last ones now to join the European network in finally embarking on international standards, which for security and safety reasons, Germany had a lot of preparatory elements in its own coding, which completely impeded precise generation of data and digestion of data, and also the bridging to other countries. And now with the EU presidency, which came in the middle of the pandemic, which Germany held at that time, we very convincingly now embarked on joining the space of becoming international, of setting right standards, and of finally convincing the democratic debate about the fact that it needs data to protect lives.
Thanks, Markus. We're going to be getting into that standardization and the efforts that are undergoing in Germany a little bit later. Ioana-Maria, what are your thoughts on this?
Indeed, the pandemic has spurred the collaboration on the digital side. This has been, and put, for instance, the eHealth network, which has been working for quite a long time on this, it put it at the center. It has required a very intense effort, over 300 meetings between March 2020 and now for contact tracing apps and EU digital COVID certificate alone. But it has showed that there is a huge capacity at national level that can be brought together and can steer the European collaboration, putting Europe at the center and making Europe a global standard setter, as it has happened, for instance, with the EU COVID certificate. It has also showed, first of all, the role of this collaboration, the role also of strong possibilities for doing this with, for instance, the EU COVID certificate certificate has a strong legal basis, a new regulation for doing this. It has underlined the need for the interoperability, and also, again, I think it has shown the amazing capacities that the member states have nationally, can further develop and can bring together at central level, at European level, to boost basically the developments in Europe and to boost the role of Europe globally.
I think that's a really good news for everyone looking forward to the European health data space. You know, that countries seem to be already on the right path. Estelle, what are your thoughts on what we've learned, or what's been the thing that you sort of noticed the most during the pandemic with health data sharing?
So I'm coming at those questions from a data protection and cybersecurity perspective, and so I think it was really revealing to see how, actually, because Europe has been a standard setter on data protection, how ready the civil society community, the academics, and the institutions were to respond to a really urgent need to share more data, because the question was not whether or not to share data, but how to do it safely and in a way that best help practitioner. And it really showed the value of Europe investing in data protection, in setting really clear rules for a long time so that we would be ready for that. But it also shown the flaws and the work that still needs to happen in terms of cybersecurity, with the increase of ransomware, the increase of data breaches, and really put the reality that when we share more data, and as it is needed, you also need to put a lot of focus on data security and cybersecurity, and there's still quite some work to do.
We'll be getting into that when we talk about the health data space. Maurizio, you have an interesting perspective, a sort of more on the ground, if you will. What do you think you've seen during the pandemic?
Well, I happen to be one of the first doctors in the outbreak in Lombardy, which was happening just after China, and also to be the president-elect of the European Society of Intensive Care at the time. And one message which I think is very important to share is that information from data can save lives. Of course, we have to do it with protecting privacy and all the data protection rules, but during those early days, being able to identify that there was a secondary transmission in the area, that we wanted to share with the rest of Europe, was very important information to share with the rest of the community. And it helped people to prepare just to have this. And on top of that, also, I think one big learning is how fast we can get together with the scientists doing research trials, because we talk often about vaccines. But one of the biggest advances that we've seen in research collaboration was sharing information from trial from different research platforms made to be ready for a pandemic. And dexamethasone, which saved many lives, was only possible by being able to do research at global level and to share this information very fast.
We'll be talking about the secondary use of health data, which is obviously using that for research. But as a starting point, we're going to be looking a lot at the European health data space and how it could change things and where concerns lie. I wanted to know from Ioana-Maria, where we are with the legislative proposal, what progress has been made, and can you give us any more of a precise timeline for when it might land?
Yes, the legal proposal is supposed to be adopted by the Commission at the beginning of next year, in the first part of next year. We are now in the internal procedures, which are quite complex in the better regulation impact assessment phase. So the Commission has put in place a system which is extremely thorough, which analyzes proposal from economic, social, SME, competitiveness, international point of view. So it's an extremely thorough process. Requires both very thorough preparatory work, but also very thorough collaboration and consultation with the outside world. We have finished also the public consultation in open public consultation in July, and I would like to thank those who have participated. It was met with quite a high interest, I would say. We have analyzed the replies, and I would say that there is a high support from the stakeholders for the control of patients over their health data, both in terms of access and also portability between healthcare providers and between of the data coming from different sources. And there is also a very strong support of the stakeholders for reuse of health data for research, policy making, and regulatory purposes and statistics, of course. And this is something that we clearly take into account in the next steps, impact assessment, and also the legal proposal.
Thanks, Ioana-Maria. It's good to hear that it's moving along swiftly. I know some of the panelists have been involved in providing feedback on the proposal, as you just spoke about the consultations. Estelle, how inclusive do you think the process has felt, and also what were some of your key messages? Are your key messages for the Commission as they develop this proposal?
So I think a key part for us when we talk about health data, and sometimes I think there is a sort of a starting point where it almost feels like when you work on privacy and data protection that your default position would be please don't share data, while our position is that share data with appropriate safeguards around it, and in particular in the health sector, I think there is no question of whether or not you need it. It's again how you do it. And so some of the key points with those developments are how to operationalize some of the existing safeguards, like a right to portability and system talking to each other. And so how almost talking about those boring operationalizing ways of what's the format for data to be shared so that it's understood by all systems, what's the security system behind all of those spaces so that it can be safely shared for research, but it won't be accessed by third party and it won't be endangered. And I think a really important point also as we see more development and sharing of health data is also seeing how there is a huge interest from industry and all industry, including big tech, in harvesting those data and using those data and putting a lot of focus on those public procurement and who will hold the infrastructure behind those spaces, because it gives a lot of powers to the industry doing so. And I think already the COVID pandemic has shown how reliant we are on big tech companies even to deliver apps. You're not able to do COVID-19 apps without Google and Apple. You have to rely on them, and this creates a lot of question on how dependent we are on them and how much power you want to put into their hands because of the many privacy and data security issue that there are with those companies already in the commercial sector. So handing over health data creates additional issues. So really thinking which industry and how much public involvement actually and control we should have over the infrastructure.
On the issue of data protection, Markus, given your experience in Germany with implementing electronic, health records and now rolling out e-prescriptions, how has, gematik helped to convince patients that their data is secure? And, how do you build that trust? As patients are skeptical, and I think often rightly so when they see, evidence of data breaches.
Well, obviously, we see a big spectrum of how the population reacted, right? The Corona app, for instance, is now downloaded by 30 million. It's one of the records, but it's still not enough to really work completely as it should be. While the app that uses the vaccine approved is now downloaded by 45 million. Almost all vaccinated people have now a digitally proven, convincing pass for themselves, and they have now embarked on the vaccination pass as a whole, right? So we see, first of all, that the tool needs to convince in its usefulness and its practicability, right? Which is always a balance between the entry barrier you have for data protection reasons, how many hurdles do you have to surpass as a citizen to use your application simply and in the palm of your hand, and then again, how much do you know about the background, right? And we made it very clear that, for instance, the information text and consent text was in a language and in a structure that is not overwhelming you, but it is a very clearly structured, very short sort of text that makes it very clear what does this app do to you and what does it not. And there's a lot of testimonies, obviously, to this, and the principles were discussed in public, in parliament, and also even in a lot of talk shows about decentralized or centralized storage of data. And I think the population really got the implications of this at the end. And gematik is trying to give them all the confidence that their data will be treated if you want, so in the European philosophy and not in the philosophy that we see in other continents, be it more individualized or more societally oriented, like in China, right? So, it is not so much only a technical convincing department, it's also about how is the tonality of your communication and how transparent does it convince everybody that you're talking to the whole fundamentals of your product.
Thanks, Markus. And speaking of patients, of the real people actually involved in this data sharing, Maurizio, you have many hats, but one as a doctor in an intensive care unit, as you just explained. What kind of possibilities do you see in that particular space for the sharing of health data?
It's many possibilities. You can think about that individual patient that comes with an emergency at that moment, and for instance, to have a way to electronically pull information like allergies or treatments that didn't work in the past or treatments that have been not working on this patient. That could be very important information to have, which often in an emergency we do not have because you don't have the time to ask the question, or maybe the patient is incapacitated in the moment due to the acute condition to give you some answers. So to find a way to get that information to help that patient would be extremely important. And then, of course, in intensive care, we treat a very sick group of patients. So everything that you learn from a single patient put together in a large database could actually help other patients in the future. We see some attempts on that. We've also participated with our society with some attempts to create completely anonymized sets of data sets that could be used basically to simulate treatment, to simulate how things can work maybe for the future.
That's really interesting. You said so there are a couple of initiatives like that. How successful have they been?
So, for instance, with Amsterdam, we've created a database based on their health records in intensive care, and we participated with our data science section of the European Society of Intensive Care Medicine. And so, for instance, we've also done datathons. Datathons, for people that are not familiar with it, are events where we bring together clinicians and data scientists together. We create teams, and they challenge each other on clinical research questions on the data sets with artificial intelligence, machine learning. It's actually something that it's easier to do now than what it seems, and sometimes it scares doctors to go into that field. It's much easier to do than now. Now, these are done usually on a very selected group of patients done for this data set, completely anonymized and so on. But you can imagine in the future that by keeping this anonymization, we could create a massive intensive care registry in Europe, where we really share this information in real time, and something that is discovered maybe in Germany could help a patient in Italy and vice versa. And I think if our mission, as we believe, is to help patients and families to have better outcomes in intensive care, we need to find a way to use the information this way.
And another large data sharing project, is the European reference networks. And for those listeners who don't know, these are networks that focus on specific rare or complex diseases and draw on expertise from across the region. Ioana-Maria, what is the future of these networks, and could you see an expansion of them with the creation of the health data space?
Yeah, maybe if I may chip in on what Maurizio said before about the importance of data, having information about the medical record, about the medical history of a patient, which is extremely important, especially when the patient is in a critical situation. I would like to explain a little bit what has been done so far at EU level. So in the EU, there is an EU infrastructure supported by the e-health network, which allows the patients which travel in another member state to share either their patient summary or to get their e-prescription dispensed in a foreign pharmacy. And their information is the essential information about the allergies, about the medication, devices, pregnancy, etc. And it is being shared in the language of the professional, of the country of destination of the professional. And for the time being, we have 9 member states which participate in this sharing of patients' data, which is extremely secure. It's done through an IT system called Testa, etc. I don't want to enter into too technical details, but this is of course, the precondition is that the data exist at national level, that it's also properly coded and structured, so it can be translated easily. Otherwise, if the data is not coded in the right form, the translation becomes very difficult, and the information that can be shared are especially in PDF or in the original language. So there comes the interoperability. So this is one element which is extremely important. Now, because not all the member states are using the yet, at least My Health at EU, during the pandemic, we did at the level of the Commission an urgent adaptation of CPMS, which is the clinical patient management system, which supports the European reference networks, so that the hospital of origin of patients, especially during the peak of pandemic, they could upload the data of the patient, and the hospital of destination could download this data. This has shown again during the pandemic how important it is that the data of the patients can be shared between healthcare providers and also between countries. This is what we try to support. Now, the ERNs, they are indeed a unique model of collaboration between healthcare professionals in Europe. What do? They support the treatment, the diagnosis and treatment of rare disease patients, also knowledge generation, information in this area. And their added value is precisely the fact that pulls together resources in areas where the knowledge is very scattered. I mean, the rare diseases are rare, and also the knowledge is not is concentrated in some excellent centers. And we are also supporting the specialists to discuss together the cases of the rare disease patients. And what I find really amazing also with the digitalization is, for instance, the fact that a child in Romania or Bulgaria can get his or her case discussed by the best specialists in Europe, while, for instance, maybe the health system wouldn't necessarily afford to send this child to get the support and the advice of such specialists. This is, of course, done in a very secure way, and with a lot of data protection and cybersecurity precautions. There is also an implementing act which sets out the tasks of the Commission and of the healthcare providers as controllers, as joint controllers in the system, etc. I don't want to go into too many technical details, but I think this is a model indeed that we try to see how we can scale up at the level of Europe. We are now looking into the possibilities of supporting the member states to use this model also nationally. There are some member states which are using already such systems of supporting their member states, their healthcare providers to discuss cases of rare disease or other patients. And we try to see how we can scale up and how we can further enlarge this type of consultation support, etc. And maybe one more thing, that the ERNs were extremely useful during the pandemic. We organized a lot of discussions between the ERN members, which comprise around over 300 hospitals over Europe, with over 1,000 sections in those hospitals. So we supported them to discuss among themselves about how to treat COVID patients, which had COVID, but possibly also other diseases, including rare diseases, what kind of treatments were most appropriate, what kind of care, etc., etc. And I think these debates were extremely useful, and they attracted a lot of interest also from outside the ERS. They were organized online, and they were extremely useful, I would say. So a lot of lessons clearly to be learned from the digitalization and the COVID pandemics to take this forward.
Thanks, Ioana-Maria. We have a couple of questions from the audience. I'm going to start with one, perhaps for Markus, but other people might want to chip in. It asks, is GDPR at the discretionary level of its implementation holding back data capture to use in research? So, is GDPR holding back the ability to use patient data, really? Markus, what are your opinion on that?
Well, I don't know from which country this question comes. Obviously, GDPR is not the issue. Unfortunately, GDPR in its English version got translated into the national languages, and jurisdictions and language has a lot of interpretation depending on how the verb and other attributes are translated. The interpretation we have currently from the data protectionists in Germany go, and that is proven, clearly beyond the GDPR interpretation that we have in other European countries. If you talk about the electronic health record, for instance, there is a single position here of the federal data protection body that believes that there needs to be a data set that allows every citizen to decide on each little document and each entry field to whom he will open it up and access and to whom not. That is a so-called microgranular decision point, which is only offered by 3 European countries. All the other European countries have never interpreted it in that way, and so does not the Ministry of Health and the Ministry of Justice, gladly enough. So there is the point that we need to convene again in Europe and find out how do we interpret the original source version of the GDPR. At least for us in Germany, that is certainly something we're strongly suggesting to come back and reconvene on the interpretation of certain verbs, data, and attributes within the GDPR. All in all, though, I come back to the fact that Germany is lagging. It was lagging behind, on place 18 in Europe, and we have other homework to do, which we're embarking on the things that we may be touching upon when we talk standards and interoperability. But the GDPR interpretation of the nations and its spectrum is something that Europe needs to face and come to a common ground again, I believe.
Thanks, Markus. And, speaking of different standards across different countries, Estelle, the UK is planning to change its data protection regulations. Is there concern that this could create problems with sharing health data between the UK and other EU countries?
Yes, and I think the concerns obviously apply to the health sectors, but to really any sector. There is a global convergence towards clearer and more harmonized data protection law all around the world that started with actually the GDPR being adopted. Europe was the first mover, which gives it a great advantage, and a lot of countries are now adopting their own legislation, model after it. It's not a copy and paste of it, but it's really highly inspired. And so seeing that the UK wants to take a different path, which it obviously can, it is a little bit concerning in the sense that the digital economy is integrated and research needs also cooperation with other institutions. And so in choosing a completely different path from not just Europe, but frankly, what everyone else is doing, the UK might be just isolating itself from data sharing with other countries and from its university and its hospital being able to enter into research agreement between each other. It's quite surprising because the UK have had the same data protection model, obviously, from Europe for many, many years, but it also secured its adequacy decision, so the decision on which they can continue sharing data between the EU and the UK right after Brexit as a precondition for our economies to continue work together and for those type of research to continue. So for them now to take a U-turn and say we're going to do a different route and do things differently, this could be interesting if we were in a world where the UK had to work on its own and could develop things in its own way, but it's not really how the world is working. So it's just further isolating themselves and potentially also creating risk, because the proposals that the UK government is putting forward would be reducing a lot of rights for users, and in terms of health data, we talk about reducing rights for patients potentially. And in a climate where they are still concerned on how data is being used, it just sends the wrong message.
Ioana-Maria, just very briefly, are you concerned about the UK diverging in this regard from a Commission perspective?
Well, we are looking at what is happening in the UK and around the European Union, but I think I would say that we are also concerned about what Markus was explaining. First of all, in the interpretation of the GDPR. But moreover, the way that different member states have decided to implement different provisions of the GDPR. Let's not forget, for instance, that the Article 9 concerning the processing of health data has 10 letters, and we did a study we did actually several studies underpinning the legal proposal. One of them being how the member states have implemented the GDPR in terms of access to, in terms of data processing, be it for the healthcare provision and also for the reuse of health data for policy making, regulatory purposes, fight against the pandemics, research, innovation, etc. And when putting together the Article 6, which concerns the general processing, and Article 9, which concerns the processing of health data, and different legal bases applied in different member states, the implementation looks very complex. Sometimes it really looks like a QR code. So for a researcher who would like to do a cross-country study, the complexity it's quite big. So again, I would like to underline that the GDPR it's really a gold standard that has supported a much higher protection and also the free movement of data, but the complexity comes from the way it has been implemented. And the challenge also in the context of the European health data space is how to support a more even implementation and interpretation of the rules. So this is something that we are looking into, and this is something we are exploring.
Thanks, Ioana-Maria. I want to go into that using patient data for research. Maurizio, what's sort of the biggest obstacle in doing this? Is it convincing a patient to share their data for research, and kind of where do the difficulties lie there?
The biggest difficulty, I think, is what Markus and Ioana were saying, is the implementation of regulations at local and national level that are very fragmented and very different. Actually, when we speak with patients and with their families, they are willing to share their information, of course, anonymously. If that information leads, for instance, to share expertise, sometimes we can ask a doctor, a clinician in another country, something, and that's what Ioana was saying, and that we always talk about data traveling, but actually making this expertise traveling is also very important. And patients are willing to share information also if this information can help somebody else in the future with their condition. So often when we speak with patients, it's almost 100% of them that they want to help. There is also a lot of data that research active institutions, they have usually better clinical outcomes. So patients are often happy to be either in a trial or in an observational study. So it's also my experience that the GDPR was not really the biggest obstacle, but it was more how national this was implemented and how this was fragmented. And as a physician and scientist that work in intensive care, so with patients often not able to give the consent themselves, I would really like to see some policy that allows to collect this data for clinical and research purposes, and that it is harmonized at European level.
Thank you very much. I think that there's a sort of a thread running through that we have these sort of quite disparate ways that there's these rules are interpreted by the different EU countries, and I think that's something that you see across sort of the healthcare space. I'm sure many of the listeners will appreciate that in whatever the sort of work that they do. It's really been a fascinating session, and there's clearly a lot of movement in this area. I think we're all eagerly anticipating the legislative proposal, and there also seems like there's a lot of work to do on maybe re-looking at the GDPR regulations and seeing how countries are implementing them. And obviously there are also concerns about data protection and questions about the ability to make this data all talk to one another, which is something that's really often quite hard. Thank you to the fantastic speakers, and thank you to those of you joining us online. The next session will be on tackling the two-speed Europe on access to care with my colleague Carlo Martuscelli. If you're in the room, please remain seated as it will begin in just a few minutes.